Hi everyone, this is mini lecture number 9, and this is talking about the origin of the microbiome. And in this case, as opposed to my other lectures, this is looking at the microbiome on an individual level. So in this case, we're looking at that initial colonization of the newborn. So when we talk about the colonization of a newborn, the uterus and everything inside of it is normally sterile during that embryonic and fetal development. It's actually when the fetal membranes break, that first exposes the infant to any sort of microbes. So premature rupturing of membranes exposes the infant to infection, and often what will happen if somebody gets premature rupturing of the membranes, so they're not going into labor but their membranes have ruptured, they'll be given antibiotics sometimes, and those that don't deliver within 24 hours of that membrane rupture. But when we look at childbirth itself, this is where we get exposure during the actual birthing process. So the baby will become colonized with the mother's vaginal biota as they're passed through the birth canal. Babies born by cesarean section obviously will not get those same microorganisms because they're going to be colonized by adult skin biota. Okay, and within 8 to 12 hours after delivery, vaginally delivered babies will have been colonized by streptococci, staphylococci, and lactobacilli. Okay, so we do have an increase of cesarean sections in the United States and also in certain countries around the world. And the question is how that affects that initial microbiome in the baby. When we look at some other countries around the world that have less cesarean sections, what does that look like? That's something to think about as we move forward. So the colonization, that was just talking about the external part of the infants and probably some of the mucous membranes. But what about colonization of the large intestine? So we can look at two different ways to feed infants. The first is bottle-fed infants, and these generally get a colonization of the large intestine of a mixed population of coliforms, lactobacilli, enteric streptococci, and staphylococci. Breastfed infants, on the other hand, they end up getting bifidobacterium, and its growth is then favored by the growth factor in milk, and that's because it can metabolize sugars into acids, and that will protect the infant from intestinal pathogens. So there is something to be gained in the sense for that microbiome of that breastfed infant. It's setting itself up to actually fight infection. Colonization then continues for that infant as it comes into contact with people who work in the hospital, family members, the environment, so the air around you, indoors and outdoors, and also food they're exposed to. So when we're looking at that initial colonization, you can see that there's a number of different ways that the infants can have access or be colonized by different microbes. And so here they're showing some hand-to-hand, body-to-body, so skin-to-skin contact between a parent or caregiver and the infant. The vaginal birth of the infant can give that microbiome different bacterial colonization. Bottle-fed versus breastfed, and then even in the healthcare profession, you're going to have some exposure to different microbes. So hopefully this gives you an idea on an individual level of the type of microbiome establishment that we have in our gut. And you can see that a lot of this, some of this is changed as we get into kind of a more cesarean section or more sterile environment. For some of these things, the microbiome is changed slightly. So keep this in mind when you're watching the other videos of the hunter-gatherers. And the idea too of their exposure to the outdoors. Much of the childbirth is near the outdoors, and they have exposure to much more of the environment at an earlier age. So hopefully this gives you a good background. Okay, that's the end of this video.